Welcome, everyone. I'm so excited today to interview Dr. Chase Moon. Chase, good morning.
Good morning, Jane. Thanks for having me.
Of course, of course. Would you be so kind to introduce yourself and provide a little bit of background? Where do you work and what population do you serve?
Yes, so my name is Charles Moon. I go by Chase because it's also my father's name. That's where that comes from. I am a pediatric environmental health fellow at the ICANN School of Medicine at Mount Sinai in New York City. And I currently don't see patients right now, but we serve through our consult line the communities around New York City who have environmental health concerns. Before I started this research fellowship, I was working in the South Bronx, primarily with low socioeconomic background patients.
Oh, wonderful. And tell us what a consultant like yourself, what would be an example of a question that someone might call in with, and how do you have a Zoom with them? Do you have a call with them? How does that work?
Yeah, that's a great question. So, so where I work at Mount Sinai, we wear a lot of hats. One institution or organization that we staff here is called the Pediatric Environmental Health Specialty Unit. And it's kind of a national network for pediatric environmental health issues. The one for New York, New Jersey, the U.S. Virgin Islands, and Puerto Rico is here at Sinai. So we can take questions from any of those communities. In other places like the U.S. Virgin Islands, Puerto Rico, we have people who can help us answer those questions more locally on the ground. But here in New York City, when people call in, I actually took two of these calls on Friday, just to give you an idea. One call was from a mother who had about a roughly a 6-month-old infant, and there has been a Consumer Reports article that came out 2 weeks ago about heavy metals in infant formula. So
Yeah.
her question was about arsenic in infant formula and if the baby needed to be tested, that sort of thing. So we're still trying to get a response together. That was done over the phone. Sometimes we do televisits. Sometimes people come in person. Often that's for like asthma and environmental health concerns in the home. That's what we do a lot of in-person visits for. But the second concern that someone called about was a mother who has two older children, kind of late adolescence or early teenage years, talking just concerns about environmental fatigue with some other medical conditions, pre-existing medical conditions. And just the question is, is there an environmental origin of disease, right? Or is there something environmentally that could be contributing to this sort of illness? So we get questions about lead poisoning as well, kind of the whole gamut of a question anyone has about the environment. Anyone can call in and ask us the question, and then we're just trying to answer it the best we can.
And then are you affiliated with the American Academy of Pediatrics in this way, or is this a separate private?
So this is a public, it's funded through the government. We get our funding through the CDC and another
Okay.
agency called the Agency for Toxic Substances and Disease Registry, or the ATSDR. Some people may know it more that way. So we get our funding through those institutions, and it's a public resource anyone can call in.
Anyone can call in. Do you find that the majority of the referrals to you are from pediatricians?
It's about half and half, and it depends on the week. It depends on the month. Sometimes it's a pediatrician calling in. Some ones we've got recently are actually, unfortunately, pregnant women who have had elevated bloods during their pregnancy, and then the baby already has an elevated blood level at birth. So that's something that pediatricians deal less frequently with, as
Yeah.
opposed to a 1 or 2 year old coming in with elevated lead. So sometimes pediatricians call in with stuff like that, like, okay, I know how to manage lead, but maybe not as well as in a 7-day old as compared to a 2 year old.
Yeah.
So just checking against like current guidelines, and then sometimes it's parents calling in for different concerns too.
Yeah. I feel like we've known about the harms of lead for so many decades. Where is the majority of lead exposure now, and why haven't we eradicated it?
Great question. I think this goes into a lot of topics we'll probably be talking about. We know lead is this persistent kind of pollutant that it's natural, right? It occurs in our environments, but we put it into so many of our consumer products and our industrial supply pathways over previous decades before we really realized all the horrible health effects. And now the legacy is just trying to remove it from all the things that we put it into. So in New York State, we actually have some of the highest elevated levels of blood lead poisoning around the country because we have such an old housing stock.
Uh,
And that's where we see a lot of lead is either in lead paint that is flaking off in homes where people don't know. It gets into the child that way. Another big source in New York is from lead pipes, right? So from service lines that have lead pipes coming into them. Although New York is trying to make strides to get rid of these sources so we see less in our communities.
wow. Okay. Yeah, I remember when I had my twins and we were living in an older home. And yeah, I do recall that we had it tested. Is that testing something that people have to pay for? I can't remember if how does it work to have your paint tested?
Yeah, so it really depends on what community you're living in and what kind of housing you're in. For example, in New York City, if you live in public NYCHA housing, they have a program where if lead is identified in the home, NYCHA has funding to take care of that. But if you live in a private home
Yeah.
or a different sort of private rental situation, that's where things get messier. And then it also gets messier when you move out of New York City into other communities. Sometimes they have dedicated funding to address these things. Sometimes they don't. Although there is legislation at the New York State level to hopefully give low income and middle income households more resources to deal with these sorts of things in the home. So when testing is actually done, if someone comes into the home and wants to do lead testing, the most modern method of doing so is something called XRF. It's a sort of X-ray. I can't remember the RF stand for right now, but it's a small gun, and you just scan the wall and it tells you how much lead paint is in it. And then, or lead is in the paint if it's there.
Yeah.
And there's special people who come in and do the testing. There's special contractors that need to come in to clean it up if it's found to be there, because we found that if lead is not properly remediated, it's creating all this dust. It can come home on the people doing the contract work and they're
Yeah.
poisoning their own children. Or if children are still living in that home, oh, we identified lead, we're getting it out, that's so good. Oops, the lead level just went up 5 points because the dust wasn't properly remediated and now it's getting into the child, right? So there's efforts in New York State to make that process better funded and more accountable as well to protect families and children.
Wow. Let's bring it back to you. Tell us
Mhm.
a little bit about your evolution as a pediatric environmental researcher and advocate. Was this something that you knew before going into your pediatric residency or something that evolved over time?
I was not really thinking about environmental health when I first started as a resident, but looking back, I would say it started when I was very young. I grew up in rural northeastern Pennsylvania, in the anthracite coal region. So when we were driving around my communities, we were seeing old mines. The Little Schuylkill River, which was going through my town of Cressona, Pennsylvania, was often orange with mine runoff, and that was just something like I was, oh, like the stream is orange, right? Like
Rivers
who
are
like
orange.
everyone's just driving, right? Like I knew not every river was orange, but it was like that was part of my lived experience. Something else in Pennsylvania, that not super close to where I live, but it's called Centralia. It's an old town that actually the federal government had to take over through eminent domain and get people out because there was a mine fire that started back, I can't remember when. It's been decades now, but that fire is still going. There's still a
About
coal
that.
fire underground, and they had to evacuate the town because you never know when the ground is going to open up and there's going to be fire underneath you. So that was kind of the legacy I had growing up that I look back on now and say, oh, I was probably in an environmental justice community growing up. And then when I was in middle school, that's really where it started. Middle school science fair project as a sixth grader, I decided, I don't know where I got the idea from, but I was going to test water quality in a stream, not the orange stream, but a smaller stream going into the orange stream, where I was going to test water quality slightly up towards the head springs. And I lived in a rural farming community and then testing it in the town. So I was looking at urban versus rural water. And I won first place for that as a sixth grader. So I was like, oh, like this is something I know how to do. And then I kind of ran with that. In seventh grade, I went around my community and around my home and took soil samples and tested for lead in them to see
Oh
what
my
lead.
God.
And then as an eighth grader, well, this is probably around 2008, I was like, I'm gonna, blow into a balloon, get some off of a car, different areas, and test for CO2 in those and compare different things. So, and then after that happened in middle school, I kind of forgot about it. And was like, and I knew I wanted to do medicine. I knew I wanted to do science. And then I got to my pediatric residency here in the South Bronx. I was reading a book in clinic waiting for a patient to come in called Bright Futures, which is really our Bible for preventative healthcare guidance. So, a baby comes in for a 6-month, a 9-month, a 1-year well child visit. We have a whole book saying these are the sorts of anticipatory guidance and sorts of screening and milestones you need to go through for each visit. And I was looking through that. I was like, a light bulb went off for me. I was like, we're not talking about climate change. We're not talking about anything to do with it with families. And for me, that is kind of where it reconnected for me and was like, this is a big need. I don't know anything about it myself. And that's kind of how I restarted back on the road on environmental and climate issues as a pediatrician.
Wow. So did you change your pediatric residency in any way, or was it after residency that you then made, plotted your career?
I was very lucky in terms of my residency. My program is called the Social Pediatrics Residency Program. It's a little bit different than a regular pediatrics training program in that we have additional primary care clinic time, and we also had additional time set aside to do research. So it was really as a second year resident when I was trying to determine what I wanted to do as research that this light bulb went off for me. So I didn't really have to do too many changes. I had the flexibility in the program. It's funny because the light bulb went off pretty much the same day. I was like, I don't know anything about it. I want to teach myself. I was a resident. I was like, the easiest thing to do is to teach other residents about this. So my initial research was, okay, I'm going to build a climate curriculum for the residency program,
Oh
which is
my
what I did.
God.
Well, I did that as a resident, and then we did an evaluation to make sure it worked, and we got that published in December, which was great. But that is how it started, and it was because I was a resident and this was the easiest way to do it.
Wow. And then what happened in your career post residency?
Yeah. So actually, so I started as a second and third year resident doing this. Thankfully, being in New York City, I was able to connect with the Sinai group as a second and third year and start learning about this fellowship program at
Um,
Sinai. I stayed actually to do a chief year as part of my residency program, and that was 2023, 2024. So I didn't really have any time between residency and doing this fellowship. I identified it at the right time in residency. I did a chief year to finish up my research to build more advocacy relationships as well. And then in September of last year, I started this research fellowship at Sinai. So it
wow.
worked out pretty well for me.
Um, I'm always curious, and some of my viewers who are OBGYNs, I think might notice a difference between where the American Academy of Pediatrics is at in terms of both climate change and environmental exposures. And, I learned in preparing for this interview that the American Academy of Pediatrics actually was the first major medical society to release a policy statement on the health effects of climate change in 2008. What do you think it is about the field of pediatrics that has led pediatricians to make the connection between climate change and health and issue that first statement?
Yeah. Um, I think it's a really good question. I was not practicing back in 2008, but I would love to hear that story from someone who wrote the first policy statement. Hopefully, I'll be able to share that with you someday. What I personally think why PED seems to be so much farther ahead of,
Yeah.
other disciplines on this is, we've almost been forced to confront it in ways that other disciplines haven't. I'll give you a few examples. So, we've seen over previous decades things like lead poisoning, right, in our communities and the effects it has on children. We've seen things, other chemicals like DES and how it causes adenocarcinoma in young girls of mother who've been exposed to it. things like thalidomide and methylmercury, all these different sorts of environmental contaminants that often affect fetuses in the womb, right? And then
And
present as either congenital defects or neurodevelopmental issues in children. So, as these things have been discovered over the previous few decades and public policy has changed and more research has been done, a lot of it is happening in children because of their unique vulnerabilities and all these vulnerable periods during development. So, pediatricians have been organizing on environmental health issues for decades because of that and building up this. So, when climate change started to become more of a thing, there was already this group of environmentally minded pediatricians
I see,
within the
yeah.
organization, I think, who were like, were immediately able to recognize that this is a huge health issue and we need to start talking about it now. And I think it's just because of that legacy of, decades ago that we've been able to build this community of people and pediatricians who are really focused on these issues.
Yeah. No, now that makes perfect sense. And while you were speaking, I thought back to an experience that I had a couple of years ago reading that book, Paradise Falls, about the Love Canal. So, for those who may not know, the Love Canal is just an hour west of me here in Rochester in Niagara Falls. And it was a community where a petrochemical defense manufacturer buried a bunch of barrels of toxic chemicals related to the war effort, but then also pesticides and herbicides and other manufacturing byproducts. And then they covered it up and they sold it to the town of Niagara for $1. And purportedly they told Niagara, that there were these chemicals buried there. But regardless, Niagara built a school near the Love Canal, and it was the mothers whose children began to be affected, began to show health effects of these chemicals that started the investigation. And obviously it became a Superfund site. But yeah, now that I'm thinking about it, probably a lot of environmental movements have started due to childhood exposures.
Yeah, I would agree. I think, I was talking about the children, right? But it's often the mothers bringing these concerns forward, right? We think about the astute clinician being prepared to identify new associations for things that are happening in their communities, right? But really, it's the families who are experiencing it first and bringing it in. I don't have too much experience with the Love Canal, but this is we've had someone recently reach out to our consult line too, as well, about the Gowanus Canal in Brooklyn, right? And do they need to be concerned about exposures there with their children or with schools around them? We see it, I worked in the South Bronx. We have a highway that was built through our communities by Robert Moses decades ago. And if you look at maps now, there's many schools within 500 feet of that highway that are exposed to air pollution too, right? So something, I've only started doing this work in the last 2 or 3 years. So I don't have that much of a perspective looking back, but I can say even from the last year or two, I think more people are starting to realize that and look around their built environment and say, hey, there are things here that maybe aren't good for us. Like, what do we do about it?
Yeah.
So it makes me more optimistic that people are asking these questions and trying to find answers.
Yeah. Um, I'm curious, and this is purely speculative, and you can pass on answering if you want. But do you have any idea what some of the barriers might be to the other specialties in looking at environmental exposures as either a contributing factor for disease or a causative part of disease? Do you have any thoughts about that?
Yes, I think, yeah, and I'm sure it will be a lot speculative, but because I do medical education work, I think that's probably where I'll land with my answer. And that, it's because we don't learn about it in medical school. We don't learn about it in any of our training, right? That's why I came to do this fellowship as well, because I had developed some expertise on climate health issues, but I knew there was this whole world of environmental health stuff that I needed to learn more about, and I kind of put myself on this pathway, right? So, one thing that people are trying to do now is put more of this environmental education, not just in medical school, not just in residency programs, right? But also preschools and K through 12, and then also figuring out how we put this continuing medical education. It's
Mm.
more of a lifelong learning issue, in that, we have the research, where we have the health connections, we know it's going to impact our practice. Now, how do we get everyone on board? For example, right, like, I don't think I was ever taught how to take a full environmental history in medical
Right,
school or
right.
as a resident, right? I don't think most people who are in practice have learned that. Even starting to teach medical students just how to take a few extra history questions, right? That's a huge step in terms of being able to think about it as a resident and as a practicing physician down the road. So I think really where we have to go with it is, making sure people are aware of it, making sure that they're aware that it's not just like a little bitty health effect, right? Like a lot of our non-communicable diseases and the way that we're seeing that disease burden increase, especially over the last few decades, is often connected to these things. Like it's making our clinics busier, it's making our patients sicker, and there's things that we have to do about it, right? So that education, I feel like, is the first step to get people to realize and take action.
Yeah, no, you hit the nail on the head there, and that is, obviously, absolutely starts with medical education, then in training and in residency as well, and then continuing medical education. This has been something that I'm super passionate about because as you know, the fetal period, the in utero period, has a more profound effect on that child than the period after they're born. In part, their blood-brain barrier is more porous. Their liver is not fully developed. So any environmental exposures that a fetus is exposed to have multiple times more impact than after they're born. And yet OBGYNs who could be having an environmental history or taking an environmental history during the prenatal period, it is not routinely part of our counseling. I will say we do get questions about, should I dye my hair? We get questions about what foods are safe in pregnancy. But we don't necessarily advise our patients not to heat their frozen meals in plastic in the microwave. So I think that we are trained briefly to think about some environmental exposures in pregnancy, but not comprehensively. And the problem there is that, the way that pregnancy unfortunately is billed to insurers, whether it's Medicare or I'm sorry, Medicaid or private insurance, is, it's part of a global, right? And so the OBGYN gets a global fee for the entire length of care, including the delivery and postpartum. And so what you end up seeing are these very, very short interval visits. I worked for the nation's, one of the nation's largest HMOs, Kaiser, for many years. And, our slots are the number of minutes that we had for a prenatal visit would be, somewhere between 10 and 12 minutes. And very difficult to take an environmental history in 10 or 12 minutes.
Yeah.
In addition to obviously performing and addressing all of the other healthcare needs of the pregnancy in that period of time. So as much as I want and hope that OBGYNs watching this will think about how they might change their practice, I also am conscious of the fact that we aren't really remunerated or paid for our time in doing these sorts of things. And so we would ideally love to see that change at a federal level because those reimbursements, that's where those happen. Okay, but moving on, I feel like I've gotten a little off track here.
No worries. No worries at all.
Um, Tell us about the first time that you went to Albany to advocate for children's health in front of state senators and assembly members, and what was that experience like?
Yeah, that's a great question. So, for anyone who's listening, I didn't put this in my introduction, but I also am a public policy and advocacy co-chair for the New York State American Academy of Pediatrics. I do a lot of policy advocacy up in Albany on these sorts of issues that we're talking about. I started as a second year resident. I started my training in COVID. So, I think it was probably 2022 when we first decided we were going back to Albany in person to do these sorts of things. And I remember sitting down in the morning in a hotel conference room. There were legislators coming in to talk about specific issues. And there were a few things I realized right away. One was that I had no idea what I was doing. Two, that there were some older pediatricians in the room who were really eloquent advocates speaking to these people and trying to get answers. And three, that even though I didn't know, I wanted to do it, right? And I needed to learn more. And I think what was immediately apparent to me was that, especially these older people in the room, they had been doing this for a while, right? They had been advocating for a long time. And for me, it was like, okay, this is a longitudinal thing where you have to really build relationships with people. So after that, this was a New York State AAP Advocacy Day. Which wasn't really focused on environmental health issues specifically. I was like, I'm interested, I want to learn more. And I started reaching out and learning about new different coalitions and joining their advocacy days. So the one that I hooked up with the first time is called the Just Green Partnership. And they do an Earth Day advocacy every year. So that was Earth Day Advocacy Day every year. That was the first one I went to outside of the AAP, where I was with, I was the only pediatrician there, but I was
Oh,
with a bunch of policy advocates who had been doing this for a while. So I found it really powerful to be able to practice my skills as a pediatrician and learn how to talk about how the health impacts are happening, but also to see how they were modeling having these conversations and also talking about the nitty gritty of the legislation and bill numbers and the sponsorship, that sort of thing, right? So, and over time, building those relationships and joining with those groups, I've been able to learn a bunch of their skills. But for me, it was immediately like, I don't know what I'm doing, but I need to learn how to do this better.
oh, I love that. I love that. And you recently shared with me a success regarding PFAS legislation in New York, in the New York State
Yeah.
legislator. Could you tell us a little bit about that win?
Yes, I would be happy to. So, right now in New York State, the Just Green Partnership, the PFAS Free New York Coalition, is advocating on three specific bills around PFAS. And all of them are really banning PFAS in a variety of products because we know that is one of the exposure pathways for how it gets into our body. The big bill that wasn't passed is called PFAS in consumer products. It's kind of an omnibus bill to ban it in lots of different consumer products like ski wax or dental floss or just random things that you'd be like, why is this in here, right? The two other bills make a little bit more sense and are more targeted. The other one that didn't pass yet is called the Beauty Justice Bill. It was formerly known as the Safe Personal Care and Cosmetics Act. So that's banning not just PFAS, but other toxic chemicals in consumer products for often women. So we're thinking about beauty products like creams and lotions, but also any other sort of makeup. The big bill that did pass that you were asking about is PFAS and menstrual products, which I think anyone who's listening to this would be like, why is there PFAS in tampons or sanitary pads or whatever, right? Like, why was that even there to begin with? So both houses in the New York State Legislature passed that bill last week, and we are just waiting for the governor to sign it into law. But that's a big win in terms of protecting our New York communities from PFAS, especially people who menstruate.
And one question that I have, and I hope to join you in Albany soon. One
Mhm.
question that I have is when you have a state that passes a ban like that, how do the manufacturers of those products make sure that after, it goes into effect, which I assume will be, next year or the year after, how do they make sure that the products sold in New York State don't have it, but yet the products sold in a neighboring state might have it?
That's a great question. I think that's one of our strategies as an advocate is it's as advocates is it's really hard to just put PFAS in some things and not in others. So one of the strategies kind of around the country is if we get it passed in a few states, right? Like it's much easier for industry to just take out toxic things from everything, right? Instead of keeping them for some states and not for others. So I think part of the goal there is to make it as difficult as possible for the producers to continue to make two different forms of it. But this is also within the context of knowing that there are safe alternatives to put into products, right? This often comes up as part of the legislative conversation that you're having with offices is before it even gets passed, they will ask these sorts of questions because they're hearing about the concerns from the industry. It's like, oh, I just spoke to this chemical industry representative, and they're saying that they're not going to be able to take it out in time, or what are we going to do if we don't have products on the shelves, right? So that's when we say, okay, there are safe alternatives. There are states that have already banned this a few years ago that are already in the process. To me, I always come back to lead with these sorts of things, right? Because it's lead, we took it out of gasoline. They said they wouldn't be able to, right? There was this big hullabaloo about it back in the 70s. And look, the world is still running. We don't have lead in our gasoline. We've taken lead out of paint, out of all of our products, right? The world is still running. We're healthier. We make more money because we're healthier from it too, right? So
Right.
part of it is just getting past these industrial fears of not wanting to change, and their short-term bottom line is going to be worse, to saying, medium and long term, this is actually going to make your business model better because people are healthier and buying more things and more productive in their society.
Right. Yeah. Those studies that show how many IQ points we've lost as a species due to lead exposure is always
Yes.
like, oh my God.
And conversely, all the IQ points we've gained since we've
Right.
taken it out of things too, right? It's an easy way to improve academic performance.
And maybe you've already answered this in the discussion that we've had heretofore, but if you could remove just one exposure for children, what would it be, and would it be lead?
This is really tough. This is a really tough question. When I saw it, I was like, I don't know how I'm going to answer this. Um, if I was going to do it by like a class of things as opposed to one specific thing, I would say fossil fuels, right? I would
Yay,
say
I love
fossil
that
fuels
answer. I love that answer.
because we know fossil fuels are the feedstocks for things like plastic and other chemicals. And we also know that fossil fuels are what is increasing carbon dioxide, right? We can't get rid of carbon dioxide because we still need that actually, but we can stop putting more of it into our atmosphere. And we know getting rid of fossil fuels is not going to fix every problem tomorrow, but it's going to help us get a long way towards the healthier futures we want to live in.
Oh my gosh, I love that answer. Um,
But lead would be number two.
Lead would be number two.
Yes.
And are you currently mentoring, are you teaching residents in your role, or not quite yet in your career?
No, this is one of my favorite things to do is because I identified this as a passion during residency, and there weren't thankfully I had my group at Sinai who was able to support me. But lots of residents, lots of medical students will reach out and say, hey, I'm interested in doing something like this. So I always try to support, I always try to mentor as much as possible. I still do the medical education up at Montefiore, which is where I came from for the pediatric residents. That's really important to me. And I'm really aiming to do more education for more residency groups too. So yes, always happy to help support and mentor other people, below me in the pipeline who want to do this sort of work.
Yeah, yeah. I imagine I admin a Facebook group of over 7,000 OBGYNs. And what I hear from my colleagues a lot is, that they don't have a lot of time. Uh, and I imagine that time, and sometimes obviously transportation, driving to your state capital to advocate on behalf of your patients, are two of the biggest barriers. Are there any other barriers to physicians getting involved in this?
I think one of the other barriers that people have getting into advocacy is they just feel like they don't know how to do it. They don't feel like they have the skill set. That was how I first encountered it. But when I talk to people about it, I often think of it as just another skill in the physician toolbox that maybe you haven't been able to practice as much, right? But that's not what medical school and residency are for, right? That's where you learn to be a clinician and where you learn your clinical practice. By joining these other groups and going to do these sorts of advocacy days, that's where you build this other skill set. It's learning. And when you're there, right, it's just a discussion with other people. I think when I was going up, I was so afraid to speak to a legislator about a specific policy issue. But often I would see like teenagers or college students there, maybe not on the same specific issue, but advocating on something else, speaking so eloquently. And I was like, I am a physician. I have gone to medical school. Like, I need to just be confident and build courage. And then, it's still nerve-wracking, but like the more you do it, the more comfortable you are, just like speaking to a patient or doing a surgery too, I'm sure.
Yeah.
So it's really, in some ways, it is uncomfortable, but it's uncomfortable in the same way that it is to learn any other skill. So I encourage people to just try, even if it's not going to Albany, signing a letter or listening to an advocacy talk. It's really figuring out what you're passionate about and what makes most sense for you in your life. And, it's not going to Albany either. You can do local advocacy. You can do Zooms with legislative offices. You can do in-district visits. I also try to work at the New York City Council level. You can do work at the Rochester or the Buffalo or the Syracuse or the Albany local level as well. It's really just figuring out where you want to do that work.
Yeah. And talking to local media too. A lot of
Yes.
time, we have a pediatrician in our community here who goes on TV quite frequently to talk about childhood exposures and childhood safety. So yeah, reaching out. They're always looking for a great story, right?
Yes, definitely.
Um, okay, so my last question, is there anyone that you would recommend we interview for this OBGYN for Sustainable Future webinar series?
It's a good question. I think it really, I don't know everyone that, or all the topics that you cover here, but if you're interested in learning more about the legislative process, especially in New York, I would really recommend Bobby Wilding, and I can put you in contact with her. But she really leads the Just Green Partnership Coalition, and is really our with other groups, right? Other members of the coalition, but I've learned so many of my advocacy skills from her. She is not she's not a clinician, she's not a pediatrician, she's not public health trained at all. She is just a mother who has created an organization called Clean and Healthy. It used to be called Clean and Healthy New York, and has been a tireless advocate on these issues in Albany for, I think she said 15 years. Bobby, if you're listening to this, I'm sorry if I am putting the wrong number in, but I think that would be a great person to talk to and learn more about how this sort of stuff works at a state level.
I love that. Well, Chase, thank you so much for taking time out of your busy day to talk with us. And this will be up on our YouTube channel. And thank you again.
Yeah, thanks for having me, Jane. Always great talking with you.